Bonjour. Hello, everyone. I'm pleased to welcome you all to today's webinar. I think we're going to get started. Thank you for joining us for the webinar called The Inequities of Mental Health Research Funding. What do the findings mean for Canada? Co-hosted by the Graham Boeckh Foundation, the International Alliance of Mental Health Research Funders, and Mental Health Research Canada. My name is Alana Ludman, and for those of you who don't know me, I'm one of the vice presidents at the Graham Boeckh Foundation. I will be moderating today's session. It's great to see so much interest in this topic and so many of you joining us today from different sectors, government, research, philanthropy, community, and many more. While I recognize that we are all calling in from different parts of Canada and actually around the world, I'd like to begin by acknowledging that I am situated on the traditional territory of the Kanakahaka, a place which has long served as a site of gathering and exchange amongst nations. As we begin this meeting, I'd like to recognize and respect the traditional custodians of the lands and waters on which we all meet today. Je désire aussi signaler que même si cette session se déroulera en anglais, je vous encourage à poser des questions ou à écrire des commentaires en français. For those of you who don't know, the Graham Boeckh Foundation, or GBF, is a Montreal-based private family foundation that aims to catalyze the transformation of mental health care in Canada and around the world. In Canada, our work for almost 10 years has focused on transforming the youth mental health care system and improving access to mental health and substance use services through a national movement we call Integrated Youth Services. At the international level, our focus has been on uniting research funders from across the globe to increase the impact of mental health research investments. In 2010, GBF founded the Alliance, which has since grown to over 30 members and partner organizations from around the world working together to advance the global mental health research agenda. As you know, last November, the Alliance released a landmark report, The Inequities of Mental Health Research Funding, which provides the first comprehensive measurements of global mental health research funding. The report has received much attention around the world, and as such, we wanted to share some of the findings with you today and discuss the broader implications for current research funding practices in Canada. I'm pleased to have my colleague Danielle Kemmer, one of the authors of the report, here with us today. Before I turn it over to her to present an overview of the findings, I want to acknowledge and thank our panelists for joining us today. Our panel includes Katie Albrecht, who is the Canada Research Chair in Health Equity and Social Justice, as well as Assistant Professor of Sociology at St. Francis Xavier University in Nova Scotia. She's also a member of the board of Mental Health Research Canada. We also have Mary Bartram, who's the Director of Policy and Substance Use at the Mental Health Commission of Canada. We have Chanetta Jones, who's the Vice President of Research at the Michael Smith Foundation for Health Research in British Columbia. We have my colleague Danielle Kemmer, who's also the Executive Director at the Alliance, as well as a Vice President at the Graham Boeckh Foundation. We have Aristotle Vaneskos, who's the Vice President of Research at the Centre for Addiction and Mental Health in Toronto. And last but not least, we have Sam Weiss, who's the Scientific Director at the Institute of Neurosciences, Mental Health and Addictions at CIHR, the Canadian Institutes of Health Research. The panel discussion will be followed by a Q&A, during which you will be able to type your questions or comments in the chat. We also encourage you to indicate that you would like to speak, and we will be sure to unmute you to participate in the discussion. Please note that the session is being recorded so that it can be shared with your colleagues at a later date. I'd now like to turn it over to Akila Peoples, who's the CEO of Mental Health Research Canada and who is co-hosting this event with us and one of the sponsors of the study. Thank you, Akila, for saying a few words of welcome.
Thank you so much, Alana. Can you hear me?
Yes.
Great. Thank you for that introduction and the opportunity to say a few words of welcome. Congrats also to the International Alliance, or IAMHRF. It's hard to get your head around that acronym sometimes, but I've been practicing, Danielle. And congratulations, Danielle, to you for your leadership on this important work. And it's an honor and a privilege for Mental Health Research Canada to be able to be involved as a co-funder as well as co-host today's event. This is just groundbreaking, tremendous work. Thanks for the opportunity. For those of you that don't know, Mental Health Research Canada is a newer player on the national stage in Canada, but we did evolve from a provincial organization that had a 55-year-old history and a great reputation in mental health research. One of the most significant pieces of work that our organization is doing right now is that we are currently conducting the largest comprehensive ongoing data collection on the state of the mental health of Canadians during the pandemic. We have been collecting data starting in the first wave, April 2020, and taking this work through March 2022. And we've been conducting a number of polls, and it will be 13 in total during that time period. We are doing this important work in regular consultation and partnership with Health Canada, the COVID-19 Federal Task Force, multiple research and provincial agencies, universities, mental health charities, IBM, the Commission, and many others. If you're interested in this work, it's available on our homepage of our website at mhrc.ca. And I have a colleague on the call who I believe is putting that information in the chat for easy access. This information has proven already to be very useful. We've just completed poll 5. And we are featured today for the second time on the front page of the Toronto Star, and we've had uptake from stakeholders across the country. And we're very pleased to be providing useful and relevant data, and very pleased that we're able to turn around the data analysis very quickly and publish reports within 2 weeks of receiving the data, which makes this information very helpful to stakeholders. Very soon, we will have a searchable area on our website where all of our poll data will be accessible to anyone. Anyone will be able to go on our website and search it by certain criteria. That is in development right now and will soon be available. And we're very excited about that because we have a strong commitment and a mandate to share this data with as many stakeholders across the country as we can over the next year. In addition to this important work, Mental Health Research Canada also co-funds research grants. We're a smaller player on the stage for that in terms of dollars that we have available, but we always do this in partnership with other organizations to co-fund research so that we hopefully deepen our impact and avoid duplication where we can. Within that small space, our work is unique, or our process is unique, requiring elements like co-principal investigators, one being in academia, one being in service delivery, and having highly diverse perspectives on our grant assessment team. And we're able to effectively manage for our partners the entire process from the development of the call for proposals all the way through grant assessment and grant management in accordance with milestones and knowledge sharing criteria. Lastly, we also have a very strong commitment over the next at least 3 years by our board of directors to co-fund studentships and build capacity in the mental health research space. And we're always looking for partners for that. I'd very much like to extend an invite to anyone on the call that we have not yet connected with. I'll ask my colleague Michael to put both my email address and his email address in the chat. Ongoing, almost on a daily basis, we have outreach calls with many organizations across the country in an effort to ensure we are collaborating. And in fact, I just want to end by spotlighting the importance of collaboration in our sector. We don't do anything at Mental Health Research Canada alone. We always do our work through extensive collaboration and partnerships that underpins our work. And I would like to encourage leaders on this call and leaders in the sector in general to make a very strong commitment to collaboration. It needs to be a priority for us all, but it takes a lot of time and effort and commitment to truly collaborate. But I believe, and we believe at Mental Health Research Canada, that that is the way we're going to move the mental health system forward in Canada together. We need to collaborate, and somehow we need to coordinate. With that being said, thank you for attending this important session today. Very excited to hear more about the report from Danielle, and I'd like to turn over to her now to share the important findings. Thank you so very much, and it's been a privilege and a pleasure being a part of this important work.
Thank you very much. I first want to thank my colleagues here at the foundation and Aquila at MHRC. And also a big thank you to our panelists. Thank you really for taking the time for the discussion today. I think for this kind of discussion, it's particularly relevant that the different players from across the country are here to participate. So thank you very much. We don't have a lot of time, so I'm gonna dive right in. And so Alana mentioned the report that we published, and I think when you look through the report and you see like all those statistics from different parts of the world, well, I mean, one of the questions that comes to mind is, well, impact. So we're here to discuss funding practices, in particular whether our mental health research funding practices, I think, have the impact we wish. Also, obviously, when we read those statistics from around the world, one of the questions that we think about is how are we doing here in Canada compared to other parts of the world? And are we really deploying our resources in the most effective way? So we still have certainly gaps, mental health gaps to address across the country. And when we think about the research funding, are we using those resources effectively to really address those gaps, and creating the knowledge also that can be used by all players and stakeholders across the country to address those gaps. So I really hope that this conversation today sparks a Canadian conversation on how we can optimize our funding practices to really have the impact we want. And before I show you the stats from the report, I really want to give you an idea who the funders actually are in Canada. So the mental health research funders. You see here on the slide, so we analyze data from over 20 research funding organizations. Those organizations all contribute in one way or the other to mental health research. You'll see, obviously, no surprise, CHR is on top of the list. But there are many others across the country that play important roles in funding and providing support to mental health research. And many of you are participating in this webinar today, and I really hope that we get a good conversation about how we work together. Also coming back to what Akila said, like thinking about collaboration and coordination. Looking at these funders more closely, I mean, no surprise again, I believe the majority of funders are government organizations, so that really the vast majority of mental health research funding comes from funds, through funds from government in one way or the other. There's a small proportion of philanthropic contributions and an even smaller proportion of contributions from fundraising charities, but we're basically talking to a large extent government funding. Also, when you wonder, so how much do we actually spend here in Canada on mental health research? So we're very comparable to places like the UK and Australia and New Zealand. So we fund approximate around $3 US dollars. I should point out that all these numbers here are US dollars, so not Canadian dollars. Our study was international study, so we used US dollars, so just to avoid confusion. So we spend about $3 per capita per year on mental health research. Also, you certainly noticed that over the last 5 years, mental health research funding has not increased in Canada. So we fund on average about 114 million US dollars a year. And when we look at the funding patterns, so especially when we think about types of research, and we look across the spectrum from the basic and all the way to the very applied end, we see that the majority of funding goes towards the basic end, so underpinning research and etiology research, and lesser amounts go towards translational and applied. So what does that mean? Here an example, for example, less than 5% of funding is awarded to prevention research, for example, just to give you an idea. So what does that mean? So we certainly invest heavily in understanding how things work, but we don't invest that heavily yet in actually finding solutions for current mental health conditions. So that's certainly something to think about. Also, I thought I'd put up the slide to give you an idea, because when you see $3 per capita and we invest those amounts, so what does that actually mean? How does it compare to other sectors? So these are global figures. So the majority of research funding goes through cancer, health research funding goes towards cancer research, but also infectious diseases, neurological disorders, and cardiovascular diseases receive more than mental health. So we don't have the exact numbers for Canada. However, we roughly compared those numbers to the latest numbers from CIHI. And when we compare those with our numbers, we end up with less than 4% of mental health research funding goes towards mental health research in Canada. So on a global scale, this number is about 7.4%, and in Canada, it's less than 4%. But that's a rough estimate because we don't really have the exact numbers. Also contextualizing a bit more in terms of morbidity burden. So you see that mental health holds the top position in terms of years lived with disability in Canada. However, if you look at the research spending, it only holds fourth position. So disease burden and research investment don't really match up exactly. Another interesting thing to look at, I'm sure that lots of you are interested in that, what do we actually fund, especially when we think about disease categories? So the majority of funds go towards depression research and research related to substance use and dependence. Autism gets quite a bit, psychosis, schizophrenia, and then it gets quite a bit less. There's also a big bucket of non-disease specific, but this gives you a rough idea where our current priorities are here in Canada. Another important question for mental health and related research is obviously age groups. I mean, we all know about the importance of early intervention, intervening early, and the research related to that. So currently, the young are not the focus of our mental health research investments here in Canada. So roughly 35% of the funds deployed in the country go towards young people. Now, really the lion's share goes on adult mental health. So, and lastly, I want to draw your attention to a unique characteristic here of our funding practice in Canada. And that's the grant size. So our median grant size here in Canada is just over $50,000 US. This is 12 times smaller than in the United States, about 8 times smaller than in the United Kingdom, 7 times smaller than in Australia and New Zealand, and even smaller than in most low and middle income countries. So we do fund a large quantity of small grants. What does that mean? How does it compare in terms of funding practice, especially with countries that are comparable to ours? And so I want to show you this. This is an interesting visualization of our grants. So each circle here you see on this graphic is a grant, and the circle size is proportionate to the grant size. Yellow circles are Australian grants, red circles are Canadian grants. And I picked Australia because I think Australia not only is the overall mental health research budget quite similar to ours here in Canada, but also in other structural characteristics of Australia. I think these two countries are similar in many ways, so I thought I would pick this. And if you look at the medium grant sizes and the large grant sizes, so you see that actually it's quite comparable. So we have comparable numbers of grants within those size ranges. However, if you go at the outer rim, you certainly see this red circle at the around, and these are really all these tiny grants that we fund here in Canada, which Australia clearly doesn't do at all. So their grant sizes, the majority are larger. So these are the core statistics I think that should provide a good basis for our discussion today, and I'm looking forward to hear what my fellow panelists have to say and what we discussed today. And I think I hand it back to Alana with that.
Thank you, Danielle. I'm going to ask that the panelists turn on their cameras. And as they do so, I would just encourage all of you as participants to, in the chat, write one key takeaway that you're kind of leaving Danielle's presentation with. What is something that struck you, or a question you have, or something about what she presented that surprised you? And what we can do at the end of this presentation and the end of this webinar is we can actually compile that, and that may give us some ideas as to share back with you how some of this could move forward. Now what I'm going to do is turn it over to our panel to introduce themselves. I'm conscious that we don't have a lot of time, and we have a big panel and very impressive panel who has very long bios. So what I'm actually going to do is ask each panelist to introduce themselves and as well speak about the role that they or their organization plays in the mental health research landscape in Canada. And I'm going to turn it over to you, Sam, to start us off.
Okay, thanks, Alana, and thanks so much for inviting me to participate. So yes, my name is Sam Weiss. I'm Scientific Director of the CIAHRF Institute of Neurosciences, Mental Health and Addiction. And I guess as some of the slides show, we're one of the larger funders of research in this space. I got a lot of comments. I think I'll perhaps pick a time a little further along to speak to some information that I think goes a little deeper and can speak to also where I see the need when you start to cut the pie up a little bit going forward. So I'm glad to do that, but maybe I'll let the other panel members introduce themselves first, and then I'll be glad to weigh in, if that's okay, Alana.
Great. Yeah. Mary?
Hi, everyone. Thanks very much for the invitation to be here. My name is Mary Bartram. I'm the Director of Policy with the Mental Health Commission of Canada. I'm also an adjunct professor in public policy at Carleton and a researcher. So the Mental Health Commission has been around since 2007. We focus on convening and have a strong knowledge mobilization function as well in terms of translating research evidence into policy and practice. We have a bit of a direct granting role, especially with a $10 million investment in cannabis research, which we've been rolling out in partnership with CIHR and also directly to community-based research projects. So we have a last function around policy regarding research. So actually the 2012 mental health strategy for Canada, which the MHCC led the development of, was also something that I was directly involved in leading, and had a series of recommendations around the issues that we're discussing today, one of which was for the development of a balanced research agenda, including strong perspectives for people with lived experience and a balance of research across psychosocial, clinical, and neurological research. So building on some of the findings that Danielle was just reporting out. The importance of knowledge mobilization, and relatedly, the call for greater funding parity for mental health within the healthcare expenditure space writ large. Over the past year, we've been very much focused, as all of us have been, on the pandemic and mobilizing knowledge and supporting research projects related to the mental health impacts, including a polling initiative with the Canadian Centre for Substance Use and Addiction. That's a nice complement to the work that Akila mentioned in her introduction. That's all.
Thank you, Mary. Janetta?
Thank you, Alana. I am Janetta Jones, Vice President Research at the Michael Smith Foundation for Health Research in British Columbia. I'm new to Canada, so most of my comments today will be drawn from my experience of research, funding, and policy in the US and the UK. But I'm delighted to be here on behalf of the Michael Smith Foundation. We are British Columbia's health research funding agency in Vancouver and funded by the BC Ministry of Health. Our core mandate is to advance research across 4 pillars of research: biomedical, clinical, population health, and health services that will improve the health and well-being of all people and communities in British Columbia. We're not a big funder of mental health research. Our contributions to mental health research are really dispersed across 4 strategic activities. We support early career research talent that will make significant contributions to improve the health of British Columbians. We foster provincial health research capacity, further the use of research evidence in policy and practice, and advance health system research priorities for British Columbia. So I'll also hold my comments for the discussion later. Thank you for having me.
Thanks, Aristotle.
Hi, I'm Aristotle Voinescos. I'm the Vice President for Research at the Center for Addiction and Mental Health in Toronto. We're the largest academic hospital in the country that's devoted to mental health and addictions. So helping people with mental health and addictions, 30,000 people each year. And also significant amount of research. Our main research funding comes from CIHR and the NIH actually in the US, where we've been fairly successful. And also of late in particular, we've been quite fortunate with some philanthropic investments through the IAMHRF Foundation, which we partner with. And we, really cut across the whole spectrum from neurodevelopmental disorders to dementia, and our bread and butter, of course, things like depression, schizophrenia, bipolar disorder, where we help a lot of people with those conditions and do a lot of research in those areas, and a fair bit in addictions as well, including in policy research. And again, from sort of basic science to clinical trials to health services research. So it's really exciting to be here today. And like Sam was saying and others were saying, lots of thoughts and hopefully we have a good conversation coming up.
Thanks. And I recognize that our time is limited, and this is about sparking an initial conversation. My guess is people will be keen to have further conversations, and we can explore that at the end. And I'm just going to turn it over to Katie, last but not least, to introduce yourself.
Okay, thank you so much, Elena. So thank you. I am honored by the opportunity to join you here today from Mi'kma'ki, the unceded and ancestral territory of the Mi'kmaq people. So I bring perspective from my work on the board of directors for Mental Health Research Canada, as well as from my Canada Research Chair, Tier 2 in Health Equity and Social Justice program of community engaged participatory research. I'm coming here today as an early career researcher, and my work really aims to bridge medical, social, and cultural approaches to care, to analyze and mobilize knowledge and relationships to address the social and structural determinants of mental health and mental health inequities. So I'm also wearing the hat of Equity, Diversity, and Inclusion Science Lead for the Maritime Strategy for Patient-Oriented Research Support Unit, as well as a member of the CIHR Institute of Health Services and Policy Research Advisory Board. Insofar as my contributions to these other CIHR entities is really to bring a patient or person perspective to the conversation. So I come to this conversation with lived experience of the mental health system as a consumer and a survivor, and this experience has informed my interests and the methods and the approaches that I use. So it's also given me privileged insight related to challenges that exist with respect to meaningful engagement with people with lived experience and expertise, and the importance of equipping people and communities with resources and supports that make it possible to bring that expertise to inform new knowledge and initiatives. So thank you.
Thanks. And I think lots from what Danielle presented surprised many of us. I think from my perspective, the small number of many grants is one thing that surprised me. Sam, I'm wondering if you can speak to what maybe surprised you and what you think we can be doing to have impact with the research funding that we do have.
Thanks, Alana. Yeah, so I mean, a lot of the numbers, not so much that they surprise me, they bother me, obviously. When I took this job 4 years ago, approximately 4 years ago, mental health was the top priority. Unfortunately, I had to give it perhaps a little less time in the sun as a consequence first of the opioid crisis, as well as cannabis legalization, where there was a lot of need for urgent evidence and knowledge that we've been able to galvanize with the community. I'll say that, firstly, the mental health research community in Canada is one of the best in the world. And so appropriate, adequate funding should be in everybody's imperative. Now, I think what's really interesting about the deeper dive that I've taken into this, which will probably be what I'll lay down as my marker for this conversation, is that you know, the neurosciences large reap the greatest proportion of CIHR funding. So out of CIHR is approximately $1 billion available per year, and I won't go into the pieces. Almost a quarter of it goes into the mandate area of our institute, neurosciences, mental health, and addictions. That's the good news. And the vast majority of that is through the open competition of competitive in nature. Now, when you dig down a little deeper to that and you pull away what's actual mental health spend, and this is fairly accurate numbers, it's about $55 million a year, which primarily excludes basic science. So now we're talking about the other three pillars of CIHR: clinical, health system services, and the social, cultural, environmental determinants and population health. Where I'm particularly struck is that of those three, clinical is about half of the 55 million. The social determinants are about 40%, and health systems is a paltry 4%. And if I'm to suggest where we need a dramatic uptick is in health systems and services research, because as many of my colleagues who practice in the area of mental illness and mental wellness, it's putting into practice what we already know works. That is perhaps the biggest gap in this country. To me, this falls to a very great extent in the area of health systems and health services. And I'm hoping that this is an area that we can grow significantly. Now, I should speak for a moment on the commitments made by the federal government since 2015. Since 2015, mental health and access to evidence-based mental health services and improved health outcomes for mental health services has been a priority for the government of Canada. But again, the opioid crisis has disproportionately impacted the attention of the health portfolio owing to the gravity of the circumstances. And then came COVID. And as many of you know, we've partnered with many agencies to try to develop a knowledge base for a COVID mental health response. And I'm grateful for all the partners, many of whom are here today, that have worked with us. But now, just before this call, I was with the 6 deputy ministers from 6 different departments, all speaking about what are we going to do forward to improve access to evidence-based services with better health outcomes for all Canadians, taking into account the disparities in particular for racialized populations and Indigenous populations, but on the other side, taking advantage of great strides made, thank you GBF, for youth mental health services. And as we learned recently, another province just coming on board, a dramatic uptick in the development of community-based youth mental health services, which represent an important gap that has been bridged between primary care and tertiary care. And as I see the go forward, we need new health research and implementation science to allow for seamless transitions between primary care, community care, and tertiary care and back to allow all Canadians access to evidence-based services. Easily said than done, but we have to start with a learning health systems approach that allows us to understand the social, health, and economic imperatives to achieve this for all Canadians. While when it comes to understanding the brain, which of course I'm a big proponent of, this is less the matter right at this moment than using the knowledge that we already have about effective services for Canadians so that we can implement what we know already works. So I'll stop there to just give you that as my sort of like quick umbrella of perspective, but I'm really keen to hear what others think. Thank you.
Do others agree with Sam? I'm curious, you know, from other people's perspectives and in the prep conversations, I'm not sure everyone would agree that the priority right now is to focus on one aspect of health service research. I guess I'm curious what others think in terms of, you know, is that where we need to be having the conversation, or do we need to be thinking about how do we have a more strategic approach with the investments that are being made? Mary, should I call on you?
Sure. Yeah. I mean, as a health services and policy researcher with a focus on mental health, I'm certainly have some direct experience of the kind of gap that Sam was just highlighting. So I could start there. But I do think that, you know, it's sort of the same answer in a way, Alana, to your question. If that is a strategic place that needs more attention, then yes, we should prioritize there. But have we done enough of the sort of taking stock across what's needed for a strategic research agenda for mental health to be fully confident that that is, you know, the priority or a priority? What are the other priorities? And I think one of the challenges is with mental health, again, as Sam was just describing, sort of spread across multiple institutes at CIHR, as well as across different parts of the sector, or the different funders in different parts of Canadian research community. You know, that need to kind of have that overarching strategic view, I think, is what I keep coming back to in my thinking.
Aristotle, I realize you may have just jumped away from the screen, but I'm conscious that in our prep conversation, you know, from your perspective, do you think that we actually know the needs of research in Canada, and do you think that it really best aligns right now with our health, you know, our healthcare and policy aspirations?
Great question. So you know, I have a lot of thoughts about that. Maybe I can just build on what Sam said about the paucity of investment, I think, in sort of health systems, and being able to do more with the knowledge we already have. So I'm a clinician, I'm a psychiatrist, as well as a researcher in my own sort of like career trajectory, and certainly with prior clinical leadership roles, really working hard with our clinical teams to implement things like measurement-based care and sort of even like a little micro internal rapid learning health system. And I think where it's hard, obviously, in a physically large country like ours, with all these provinces kind of doing their own thing, is, you know, how do you build basically a rapid learning health system around either the mental health and addiction sector, even within certain conditions? And, you know, in the province of Ontario, we've had things like Cancer Care Ontario that have helped support that, and that have a, you know, like a set of metrics. They measure things, there's an accountability structure, and that allows clinical teams to, in theory, you know, do better with what they already have and have a, you know, a level of performance that they should be meeting. We don't really have that in mental health and addictions. In Ontario, there's this new thing called the Center of Excellence, which is really exciting, which may serve that role. You know, on that one, just to expand further, you know, something that's happened in the US recently, which I find really interesting, that's kind of funded by the National Institute of Mental Health and also partners a bit with state governments where they're interested, is a type of rapid learning health system around early psychosis care called EpiNet. So there's coordinating centers, which are typically the large academic center, and then they have all these community hubs, and they work together in a sort of geographically constrained zone to help implement a model of care, to measure a few things, to collect the data, and to provide feedback to the community sites. And that's an example of something that, you know, we have going a little bit in Canada with respect to early psychosis, but not a lot of, but that would take some federal and provincial coordination to get done. So I just wanted to make that comment, because I totally agree If Sam, if you said 4%, it's probably could do a little better than 4%. But it's something that makes my heart ache a little bit, because we know what the right models of care are. I mean, they're not going to help everybody. We still have a lot of research to do to help every person with mental illness. But the fact that there's a big gap between, you know, what we're actually doing versus what we could be doing with the already available knowledge is kind of painful. And then I don't know, I could go on, but I want to make sure there's time for others, Elena. So I wasn't sure with the rest of your question. I guess I'll just comment one other part that pains me a little bit, which is the median grant size. You know, I saw that David Goldblum's on this call. He put something in the chat. So, you know, he's always talked about Canada being a land of pilots. And we obviously have to strike this balance between making sure these really talented people who we invest time in their PhDs and postdoctoral fellowships get funded, but with, you know, grant sizes being relatively small, and a real challenge around scientific reproducibility. You know, are we strategically making our investments in the best possible way? I don't know. It's a tough balance, because you don't want to lose talented people from the pipeline, but you want to make sure you do important things. And so again, to look south of the border, and again, they have an economy of scale, but they have things called center grants and much larger grants that aim to do much more ambitious and larger things. And perhaps we're limited because we're a smaller country. But can we think about those things? And maybe those are partnerships between CIHR, like, you know, you think of the Access Open Minds Initiative as a good example with $25 million. But do we need a few more of those things that are trying to be a little more ambitious than simply investigator-initiated research? I'm not sure, but I wanted to put that out there because I didn't even realize our median grant size was so small. I thought I knew, but I didn't know it was. I guess what I was struck by was I knew things were bad. I didn't know this bad. I can say that. That's just an issue across the board from the data. And the final thing I would just say, you know, there is a tension with all of the research hospitals in the country, because medical research is underfunded, period, in Canada compared, let's say, to our cousins south of the border on, you know, several fold. So it's not just a mental health issue, and then just as usual, mental health is sort of in even worse shape. So I think it's a commitment as a relatively wealthy and successful country. Like, you know, what's our identity? Who are we as citizens of this country? Like, how much do we want to spend out of our tax dollars toward research in general?
Thanks. And Katie, I'm wondering from your perspective if you can speak to what you think we could be doing better here.
Okay, sure. Thank you, Elena. So I have to agree with Sam that there needs to be attention on the systems and on health services. And my reasoning for this, so my passion, my research passion is equity. And I think when we by naming this report, by focusing on mental health research funding inequities, there's an incredible responsibility that's there to think about what we mean by inequities. So the report identifies inequities in resource allocation to mental health research funding when compared to other kinds of health research. So whether there's parity within mental health research in terms of the kinds of research that are prioritized, as well as inequities that are, you know, there's geographic disparities, so in different parts of the world. But is the injustice, and this is what we have to ask, is the injustice in the ways that funding is allocated, or is it in its effects? So the real question I think we have to be asking is, how are inequities being reproduced by these kinds of funding decisions? And the difference is that the answer may not necessarily be to redistribute funding so that it is more proportionate relative to other places or across mental health research, but rather that the differences must be interpreted from the perspective of the impact that they're having on people's lives and communities. And so an injustice that I see, that I've seen through my work and through my activisms, you know, my background is in disability studies, that is associated with these disparities with health services research funding concerns the barriers to meaningful involvement of service users, consumers, patients, and ex-patients and psychiatric survivors in the production of knowledge about mental health. And so I'm reminded of Judy Chamberlain's activisms to have patient-controlled alternatives to the mental health system, from the late 1970s. The current situation with funding poses significant challenges and indeed formidable barriers to any types of alternatives to what she identified at the time as psychiatrist-dominated and controlled systems of mental health provision. And so, if we look again at the funding, it's etiology, it's, the basic science, it's really about defining what mental health and illness is. And that's where all of the funding is going. We know in Canada that we're committed to patient-centered, patient-oriented health research. And yet the opportunities that exist for meaningful involvement and health services would be one place where people can come in, let alone any kind of leadership, are limited. And so I think we have to ask, how are the perspectives of the people most impacted by decisions included, if at all? And the fact that we have these small grants makes it difficult, if not impossible, not only to do national work, but also to have the kind of infrastructure to support meaningful engagement of experience and to have that sustained over time so that you can build relationships and trust. So I don't think I answered it necessarily, but I do think we need to really question how we're understanding inequities when we're trying to make sense of the current situation with funding. Thank you.
Thanks. And so a few of the things that I've definitely heard in the discussion so far is there's a recognition that there are a lot of small grants. There's questions as to, do we really know where these grants should be going? There's definitely a gap in Canada around taking what we know works and implementing it in more contexts. And how are we really engaging in equitable ways, and how are some of our decisions, are they really creating equity in the system or not? And Chinetta, I'm just wondering, given the fact that you're newer than others on the panel to Canada and have experience from both the UK and the US, I'm wondering if you might be able to offer us some advice about what you think we could be doing to address some of these challenges here in Canada.
Thank you, Alana. I'm experiencing some connectivity issues, so I'm not sure if it's only me or not, so I'm going to try my best to contribute. I definitely want to answer your question, but I suspect that the rest of the panel will have a view too. I just want to really support, I think, what Sam and Aristotle both said. I agree that health services, the paucity of funding in health services research, I think, is actually quite shocking. And there's a huge opportunity to put into practice what we already know, as well as really focusing on evidence-based services, and as well as focusing on providing access to communities that are marginalized or racialized. But I would, based on my experience in the US and the UK, I would say I agree with Mary. I'm not sure that I'm quite convinced that we know enough about the research agenda for mental health and whether there's an agreement on that. And so, and I very similar to, I think, also what Katie said is we need a research agenda that actually includes not just the participation of the patient voice, but really setting that research agenda, setting those research priorities, and then really engaging patient voices, people with lived experience, communities that are affected throughout the entirety of the research process, from the priority setting to the prioritization of funding to the conduct of research, the interpretation and the translation of that. And I'm not sure that that's actually being practiced in many aspects of mental health research. So I would really echo that. I really think it's important. What I really feel really valuable about this landscape report is that until very recently, many funders, really were interested in having this landscape view. We didn't even know what our portfolios were really doing, let alone how they were really positioned alongside the rest of the world, or even in our, our country. So efforts like this, I think, are hugely valuable. What I saw in the report very much mirrored, I think, similar analyses that have been done several years ago out of the UK, for example, by MQ. And what I find really interesting is that, how many years on, has anything actually changed? So the paucity of research funding is not new information, but the question is, what are we doing about it? What I found really remarkable is really the lack of support in Canada, and also equal to Aristotle's comment about really the investment in small grants. And I think that is also a signal that the support here, and there might be fantastic talent and opportunities in Canada, but it's not very strategic. So I would agree. I think that it's worth taking a step back. And now that we're having this conversation in Canada, my advice would be to bring together different sectors, not just funders, not just practitioners, policymakers, everyone, bringing sectors even across disciplines to start to really ask what's important. I think there's a lot that we can learn about the context we're living right now. It's possible. We're living and experiencing, working in a way that's different and solving a problem, a pandemic, a crisis, because the urgency necessitates a different way of working, a way of approaching a research agenda in a way that really thinks about what's really the experience, what solutions are actually working. And I would argue that same approach, principle, practice could be applied to mental health research and mental health research funding.
Thanks, and I'm seeing lots of questions come in, so I'm going to start building them into this discussion. And I guess, Danielle, I'm going to turn it over to you, and what I've heard from this panel to a certain degree is one of the things that we could benefit from in Canada is developing a mental health agenda or mental health research agenda or strategy. And given the fact that this report looked globally, I'm just wondering if you can speak to where that might have happened elsewhere, or how that might have come through in other contexts.
Thanks, Ilana. Well, I think I'm actually happy that the coordinating piece or this element is coming up in this conversation, because I think one of the things here in Canada is, it is, as it was mentioned before, and we all know, we are organized in provinces and territories that function quite independently. However, the largest amount of funding comes from the federal government. So somehow then we need to attempt to at least align or coordinate with each other to really, I think, make this funding or those investments to distribute them effectively across the country. And so I'm a strong proponent of bringing people and stakeholders together. And Janetta, I really love what you say. This is I think there's a great opportunity to bring different stakeholders together, and also to better understand what's actually needed here in Canada. I don't think we fully understand it yet, at least not at the detail level. Something that we probably need to guide our research funding strategies. And then somehow I think we need to figure out how we coordinate those investments. So that means, you saw there are funders on the federal level, there are funders on the provincial level, then there are independent organizations. So how all those organizations line up when it comes to an overarching vision for the country. So where do we want to be? Where do we want to move the sector, and how can each of those organizations actually contribute to move the sector forward? And I think for that strategic agenda, as it was mentioned several times, is extremely important, and I don't think we have it yet. And I've seen this in other parts of the world. Coming back to your question, Alana, there are certainly countries that have attempted to bring stakeholders together, and actually beyond the research funders, because as it was mentioned several times as well, when we think about strategy and impact and what we want to fund, we certainly need to go beyond the research funder per se. We need the voice from the ground, like the people that actually do live with mental health problems. Also the consumers, like the clinicians and professionals that try to provide the services. All of those people need to be brought together to inform that strategy. And countries, Australia, for example, they've now spent a couple of years on designing a national mental health research strategy for their country. And I know it was a very lengthy process that brought many stakeholders together to really figure out, so what's actually needed for the country, and how does each of those stakeholder groups, including the research funders as one of the stakeholder groups, fits into that agenda. And so I mean, I think we need to figure out who would take the lead here in our country to actually bring all those players together. And I think it should be done. And the UK has also, I mean, the UK brings their mental health research funders together on a regular basis. Alignment is certainly very important, coordination to really achieve impact. And especially for Canada, a country that big with so many players.
Thanks, Danielle. And Sam, I suspect that most people listening are going to be thinking this is CIHR's role, and I guess I'm very conscious that the way we structured this panel was we really wanted to demonstrate that there's many players. There's CIHR, there's health research, there's federal health research funders and federal research funders. There's provincial, there's hospital foundations, hospital researchers, as well as private philanthropy. And I guess I'm just wondering, from your perspective, how do you think we could maybe move this conversation forward in the Canadian context? And also, you know, to your earlier point, how do we balance the fact that I'm hearing a bit of a sense that we could benefit from more coordination, but also need to be really thinking about how we take what we know and take evidence and implement it across the country so that we aren't a land of pilot projects?
Yes, thanks, Alana. Lots of good points there, and I appreciate all the comments. I'll start with just a comment made by one of my good friends, Jackie Bogdan. She's the Assistant Deputy Minister for Controlled Substances and Cannabis. Maybe it applies to this, right? Think big, but start small. So what do I mean by that is that, you know, Danielle brought up perhaps one of the key points, and that is that the vast majority of healthcare is delivered by the provinces and territories, with only two exceptions: Indigenous health and Veterans health. And I won't comment on how well the federal government is performing in the two areas that it does directly control, which is Indigenous health or by spending, and Veterans health, but the rest is up to the provinces and territories. My guess is that if we would like to see an increased support for mental health research, there is no question that it has to be coordinated and aligned. And I think you know, at least directly, as does Danielle, that we're very keen to do this, in particular in specific areas where we think the greatest outcome can happen that is tangible in nature. The reason I say tangible in nature is because if we're looking for additional funding from the government, it must be demonstrated to be effective in specific areas of a tangible nature that aligns with current investments, in particular by the provinces and territories. Which is why I'll just for a moment reflect on youth mental health and the growth of youth mental health services, integrated youth mental health services across the country, where the provinces are making direct investments in community-based services, which is where the vast majority of services currently exist, but in most cases, people either can't access them or can't afford them. So the fact that the governments are now creating these hubs for youth to allow for evidence-based services throughout the country, many of the provinces, using Access Open Mind, Foundry in BC as examples, truly provides us with an opportunity to link all of those efforts into a learning health systems model. And of course, if one is able to demonstrate that it works for youth, then other opportunities for community-based services will grow for there. So that's just one example I wanted to give. The other is the point that Katie brought up and that Chinetta also mentioned, and that is equity in services, which the disparity in mental health services is not unlike the rest of health services. Those who need them the most are least likely to access them in this country. And it's for many, many reasons. For mental health services, if anything, COVID has taught us that this is now being exacerbated. Just one example, there's a massive shift to virtual services for mental health, including internet-based cognitive behavioral therapies. of the several hundred studies that prove the effectiveness of internet-based cognitive behavioral therapies, a tiny fraction actually look at its impact on racialized communities and those in low socioeconomic status. So here we are once again creating a new opportunity, but the disparities themselves are off the charts. And if we don't address that at the same time, then we're simply going to grow these inequities. And in fact, there's even arguments that practitioners during the pandemic have largely ignored the inequities, in particular for mental health. So we've got some make-up time there, and I think all the points that were brought up in this regard. In the chat room, as well as from Katie's perspective, I totally agree that a framework for mental health research going forward has to include people with lived and living experience from the beginning, formulating objectives, developing strategies for achieving those objectives, developing knowledge products and knowledge approaches that can be mobilized have to include people with lived and living experience all the way through, not at the very end. As one of my good friends, Gord Garner, a person with lived experience in substance use space, said, don't treat people with lived experience like a petting zoo. Take them seriously from the very beginning, incorporate so that we have a better understanding what the needs are from the patient perspective, not from the practitioner or researcher perspective. So there's a lot to do there, and I believe we do need to do it aligned, but I think it's going to be critically important to pick areas, and in particular areas where there is already significant. So for example, we've made post-traumatic stress a major priority, in part because the federal government has passed legislation for a framework which includes research and data in this area. It impacts the areas of Indigenous healthcare as well as veterans healthcare that the federal government spends money on. And that initiative has involved people with lived and living experience from the get-go. So we're picking some areas. Some might argue it's not fair to choose areas, but at the same time, if those who provide the funding don't see tangible outcomes, they'd be somewhat reticent to make additional investments. So I'll stop there.
Thanks. And I see lots of great questions coming in through the chat, and I'm sorry we're not going to get to all of them, but I will commit that we will take them and see how we can help to share them or bring some of them forward with the appropriate stakeholders. I did want to pull out one of the questions that came up, which is, if as an organization you are trying to think about how to get involved and work more strategically and coordinated, whether it be within the province, federally, pan-Canadian, what advice might you have to think through how to work within this larger strategy? And Shanetta, I'm wondering if you might have some perspective there as a provincial research funder.
Yes, thank you, Alana. Excuse me, I can offer that, and I can also offer my experience of doing something similar in London, where I was at the Wellcome Trust. So I think it really starts from, sorry, excuse me. I think it really starts from actually knowing your portfolio of research. And that sounds like an obvious thing to do, but I don't think it's necessarily obvious for every organization, and so I think much of the analysis presented in the landscape review was absolutely, wonderful, and I think could be applied to anybody's portfolio. And the question is to ask, how well do you actually know your own portfolio of research? And then I think the critical questions come after that for every organization, and is to ask, is there a shared understanding within the organization about what the actual challenge or opportunity is? We have differing perspectives and experiences of this in this panel. You can imagine there'll be just as many differences within an organization. So I think really starting from that basis of, do we all recognize and see the same challenge and opportunity for the organization? And then importantly, that follows is, what is now the time to act and why? And what are the strengths of our portfolio that might be, as Sam said, kind of really to build on? And it could be in health services research, it could be in other types of research. And so the question I would ask, as a provincial funder or any other funder is, what is the role that organization can play in the broader landscape? And the answer should not be everything. It really should be building on the existing strengths and the opportunities. And I would also say the partnerships. Where are there opportunities to be able to to enter into partnerships that can really leverage those strengths. And I think that piece of work, that thinking, that analysis needs to happen first in order to be able to say what happens next.
Great. And just pulling from the chat again, I think there's a recognition that there is an opportunity for philanthropy to work with research funders as well. And I think, having both philanthropic organizations as well as research funders on this webinar, I think it starts to create the space and hopefully some of those connections. I'm conscious of time, and maybe what I can do is ask each of you to share some last thoughts with the audience, and specifically some last thoughts, and if you can keep it brief, that would be better. Really some last thoughts on where you think we can go from here, and what some possible next steps are, for you individually, for your organization, or for organizations who are participating, and you can choose to focus on one of those. Maybe I can start with Aristotle.
Thanks. Well, the theme of what I'll say is related to the word both, because I've noticed some things in the chat about sort of either or questions. And so to start with, I think it'd be great to get a group of people together to discuss priorities, but I think we can all agree that there just isn't enough funding, period. And I would love that this group and the energy of today continue simply to advocate for more mental health research funding, period, irrespective of where it goes, because it doesn't matter which sub area it's going to right now, it's still not enough. And I think there's been an amazing amount of energy over the past 10 years around mental health awareness. And I think I'd love us to now say, okay, we're aware that this is an issue, but we need to do better on this issue in terms of providing better care and for patients of today and of tomorrow. And so I'm going to transition to that question because I saw a question about that. And I completely agree. I think it's from Vanny Jane. I hope I pronounced the name correctly, about thinking, like services and applied health research is really about the people we're serving today. But there's no question that down the road, and especially for people for whom our current services or treatment resources don't work, they're going to be left out of the game. And I consider that a type of equity, right? So, and often when we're thinking about services research, we think about service in the community, but we don't think about people who are in hospital, who are severely ill. And to me, I don't ever want to forget about those patients, because that's why those awful asylums were built in the first place. And I really think that we need to make sure we keep our eye on the ball with that discovery research, as well as health services and system-oriented research, because there will always be people who are going to, be really ill from their illness, so ill that they're perhaps even out of touch with the reality. And I think that and commit suicide often because of those situations. So those are people I want us to always keep in our mind. And so we want to maintain a robust investment in higher risk research that might bring up new types of treatments to help people. And then I see a comment from Peter Zetmari, who I know well. And I also, one thing that is a different conversation is the pipeline, right? And I think that when there were cuts to CIHR, there are things like clinician scientist awards and new investigator awards to get new people after their postdocs supported in research aren't available anymore. And whether that's through philanthropy or the resources, having ways to support our early career people is really, really critical. And so I just wanted to, to kind of us to remember that as we talk broadly in all areas, right? So across the board. So I'll stop there.
Thank you. Jeanette, I'll turn it over to you next, as I know you may have to jump off a little bit early.
Thank you, Alana. I'd like to offer maybe 5 things, and I no single funder I would suggest could do this, but I think, again, depending upon our earlier discussion, where a funder might feel their current strengths and opportunities could do that. And I completely agree with Aristotle. I mean, the most obvious thing to do is to galvanize funding for mental health research. I think we collectively, as a funder community, as policymakers, underappreciate the length of time that it can see the benefit in an intervention on mental health outcomes. And so short-term, funding, small scale is not going to actually advance progress. So I think we certainly also have to consider changing our funding models. I think the second thing is, on top of trying to make use of what we already know and putting that into practice, I think we could also support the development of new and effective interventions at scale and their evaluation, so we can actually learn what works. And certainly, as we've discussed, encourage, support, facilitate the involvement of participants, practitioners, policymakers, players in the entire conduct of that. There's a lot, I think, that we could unpack there. The third, I would say, is advance innovation. There's huge opportunities, as we've heard, also around digital and virtual technologies, but that's going to require public-private partnerships probably, and I think there's an opportunity there for us to explore that. I think there's also a huge imperative to change the narrative around mental health. And I think many of us care about this issue, and I think we could be more involved in engaging with that in ways that, again, that really, in an evidence-based way that really includes the views and perspectives and experiences of people who are living with mental health and who are newly living with mental health conditions because of, for example, the pandemic. And lastly, we've talked about this, addressing inequities for marginalized, racialized communities in mental health research and mental health care. Huge opportunities, a lot to do, and certainly I think all of us can play a part.
Thanks. Mary, can I turn it over to you next for a few last comments?
Sure. Certainly, I think I'm just reflecting on what Sam was saying, like we need to move quickly where there's a strategic opportunity to address gaps and also consider the need to kind of do that stock taking. So that's a conversation that the Mental Health Commission would certainly be prepared to continue to have in terms of thinking through what that could look like, who could lead, who would need to be at the table. I think that data is another key input to research, and funding for data collection needs to be part of this conversation. And certainly there's a few particular gaps. What we know about what's happening in the private side of Canada's mental health system it's very opaque, and bringing that information into what we can draw on for research would be incredibly helpful, but we need private sector partners to get a window in on that data. The workforce, there's been a lot of focus on the mental health needs of frontline healthcare workers through the pandemic, which is incredibly important. At the same time, there's so little that is known about huge parts of the mental health and substance use workforce. So research on that area and also data to support it are really key gaps. So yeah, I think bringing CIHI into the equation is really important as well. Thank you.
Katie, I'm wondering if as you share some closing thoughts and remarks, if you can also speak to, I know you talked about inequities and how we're bringing in lived experience, but I also know that when we spoke previously, talk about bringing in lived experience of researchers themselves. And so I just, as you share some thoughts of where we could go, maybe offer some advice on how we can bring in both lived experience, but also recognize the lived experience of researchers themselves. And I think you're on mute.
Oh, great, thank you. Of course. So thank you so much. So just a few quick maybe closing words first, and then absolutely, I think what we really need to have is collaboration, capacitation, contextualization. So we always have to be careful when we're doing this tracking work and gathering data, and we recognize, the report's very clear that there's these conflicting interpretations and definitions that to some extent we have to bracket those conflicts in order to be able to move forward. But we still need contextualization and co-learning. And so, one of the things that I was thinking would be really great moving forward would be some kind of consortium model. Thinking again with some of Keela's remarks at the beginning of around the importance of a collaborative approach. So, you know, if we had some approach that didn't focus necessarily just on individuals as leaders, but perhaps a new vision of leadership that was distributive, that draws from and builds on our collective assets from the ground up, and here's the contextualization piece, is sensitive to regional differences and particularities and those geographic disparities, which the report presents overall, you know, from a global perspective. And one of the things that I think we always need to keep at the forefront of discussions, and perhaps this is where my response to your question around, you know, researchers, recognizing that there are researchers with lived experience, whether it's of mental health and illness, or whether it's of the system, or whether it's of work, or of the multiple and intersecting locations and structures that condition our lives. We always need to keep training and mentorship of the next generation of researchers and of senior researchers in mind. And so I'm always thinking with like the power and potential of kind of mutual reciprocal co-mentorship models that allow people to learn from one another. And it can play out in different ways. And if we want to change the system, we need to give emerging researchers as well as senior researchers the tools, resources, and supports to position them to be change agents. We need new training and mentorships initiatives, such as are offered by Mental Health Research Canada and their summer studentships and CIHR's Institute of Health Services and Policies Research Training Modernization Health System Impact Fellowship Program, which create opportunities for students and trainees to work with organizational leaders within the system and within community organizations as embedded researchers, and that are explicitly and intentionally structured with you know, EDI visions, sex and gender-based analytical approaches, not only to the work that we're doing, but also to how we kind of interact and engage with one another. And so, you know, I think that having that mentorship piece as central and some kind of relational approach that, you know, engages diverse stakeholders in different ways throughout the research process and across that ecosystem and the life course and all the language that we're using, you know, it just to really shift how we're thinking about the work that we're doing. And I think imagining that a researcher might bring lived experience, it disrupts those taken for granted relationships that we have to what we're doing, and it also makes it possible or opens up the possibility of imagining, training, and capacitating people from community so that they can participate in the work all the way through, as Sam said, so that the research that we're doing can be moved to have some kind of meaningful improvement in people's lives.
Sam, I'm wondering if you can share some closing remarks and specifically, you know, just around how we can maybe work together across different funders and across, you know, local, provincial, federal agencies to really move this agenda forward while recognizing that there's probably a larger conversation that needs to happen, but we also don't want to spend all of our time talking. And so how do we also move to action while creating space for those larger conversations?
Thanks, Alana. And I really appreciate everybody's comments. I agree with everything that's been said. There's a ton we can do, the ton we must do, and we must do it together. I've always believed in collaboration, perhaps more so now. I've heard our minister, Patty Adju, recently say about science and research that, you know, if not now, then when it comes to people's awareness of the need to have decisions grounded in evidence, science, and research. And I think that also the understanding that mental wellness is at the forefront of many people's minds, I think puts us now in a particularly critical point in time. A couple of things I'm just going to mention before I put my closing thoughts that we didn't cover in today's conversations: research and its application for mental health literacy and for prevention. I think my friend Stephanie Priest is on the line, and I think she'd bop me on the head if I didn't bring that up, because of course, in particular, if we think about the next generation, school-based approaches, mental health literacy and prevention should be top of mind as well. I'm I'm heartened by the fact that there is already tremendous alignment. I wrote into the chat room that we've been overwhelmed by support and partnership from the provinces and from foundations and charities for much, if not all, of our mental health and substance use work. I do believe a research framework that is being discussed is what's needed for Canada that takes into account the views of all interested parties, in particular, people with lived and living experience, in addition to those who directly support this work. And I believe that CIHR is prepared to play an important role here. I don't want to presume just because we are larger that we are necessarily the titular lead when it comes to this, but I can commit to you that we will play an important role because we believe, and I made this my priority then, and it continues to be my priority now. Mental health research is what Canada needs, and the fruits of that research could be transforming millions and millions of lives, and we have to do it together. So I think this is an important conversation. I'm thrilled that GBF, together with its partners in IAMHRF, got together, drilled deep. This is important information that needs to be seen by all those policy and decision makers, because without evidence and research, it'll be very difficult to make the case for health system transformation. So we're definitely in continuing the participation, and very grateful to GBF for all of its efforts, including for today's webinar. So thanks, Alana.
And maybe thanks, Sam, and great to hear that you're in and keen to partner with many of those on today's webinar. Danielle, I think I'm going to turn it over to you to share some last thoughts, recognizing that it's thanks to you that we're having this conversation, and thanks to your co-authors as well. But really, you brought forward some key findings that are helping to shape the conversation. And so I'm curious, from your perspective of what you've seen elsewhere and of what you've heard today, what might you offer to those on the call or on the webinar? What changes could they do individually, collectively, to help move this work forward?
Thank you so much, Alana. Well, first of all, thank you again to all the panelists for participating today. Working for GBF, having worked for GBF now for almost 6 years, I believe. I think we see ourselves really as an important broker in the sector here in Canada as well. Well, through the Alliance or IAMHRF, it's not that difficult internationally. I'm really excited to see the different, here is a sample of stakeholders on this panel who have now come together to have a conversation together on this topic of research funding, mental health research funding in Canada. For me, just that already, I'm really excited. And from our perspective, we really want to do everything to make sure that this is not a one-off conversation, that this is the first of a larger conversation across the country. I think something we really need. I'm very happy, Sam, that CIHR is in, and that the notion of a research framework for Canada came up today. I was really hoping for that, so I'm very happy that this came out today. I also want to acknowledge that we've had a sample of organizations on this panel. This is by no stretch the only key organizations that need to be involved in that. We are many provinces and territories. There's also, this was overwhelmingly a Anglophone conversation. So the Francophone part of our country hasn't been particularly vocal in this. Even though I don't know if you noticed, here in Quebec, our provincial health research fund, FRQS, is actually one of the larger mental health research funders in the country. So I really hope that other provincial funders also come forward and join this conversation. Also, maybe importantly, and that wasn't mentioned either, from going beyond the health research funding. So there are other from the Tri-Council, actually, SHRC and NSERC, they both also contribute quite significantly to this research funding body. And I'm not sure whether there are anybody from SHRC or NSERC on the call, but those are definitely organizations that need to be here as well to be part of this. So I really hope we will continue this and come up with a strategy to build this research framework for our country. And then lastly, from leading the IAMHRF, also one of the things we all noticed that there hasn't been an increase in research funding between 2015 and 2019, despite the fact that I would argue the public attention to the topic has actually increased tremendously over the last few years. And that certainly goes beyond research. I mean, you see now the topic on many policy agendas in various countries, like even organizations like the World Economic Forum, like it's now an integral part of the conversation. And despite all of that, we have not seen an increase in funding, which, I mean, my question is, what else needs to happen that we really can attract more funding to the sector? And so I really hope that this will change over time. This is one of the reasons also why this was the first edition of this kind of landscape work. We are planning others, and certainly a post-COVID survey is certainly in order. I mean, mental health has been on many people's minds throughout this pandemic for the obvious reasons. And there's certainly also a question whether there are any changes in funding practice as a result of this ongoing pandemic. And we'll certainly undertake a future iteration of this landscape. With that, thank you again. And
thank you, Danielle. And I want to close off by thanking our co-host, the Mental Health Research Canada. I see Akila has turned on her camera, and thank you to the IAMHRF for co-hosting this with the Graham Boeckh Foundation. And specifically, I really want to thank all of the participants for such active involvement, for joining us today, for putting in your questions and comments. We will take those and hope to share those back in some way. And I want to thank all the panelists. I think you've really left us with quite a few questions, more questions worth exploring in the future, such as, how do we increase the amount of funding coming into mental health research? Why is it that there are so many smaller grants? How do we have more impact with some of those grants? And other practical suggestions as to, for example, how do we, the need to create a research framework, the need for more advocacy, the need for more collaboration across sectors, and also, moving towards implementation of evidence-based practices with evaluation. Those are just some. I know lots more questions and ideas were shared, and what I would just say is as follow-up to this, we encourage you to reach out to each other to think through how we can move this forward together. As was said a lot, we really see this as a collective approach, and GBF helped to kick off this conversation. We will commit to following up by email and sharing some of the follow-up conversations and comments, and we look forward to staying in touch. So please stay in touch with us. Thank you all for joining us. Merci beaucoup. Et bonne journée. Have a great rest of your day.
Thanks, Elena.
thanks.
Thanks, Danielle.